Hi everyone, Dinesh Sarasena here, and today we're going to be talking about injections into a trochanteric bursa. So as with my previous video about imaging this area, it's a good idea to have the patient lying on the opposite side with both the knees and hips flexed. This will be a lot more stable and comfortable for the patient and a lot more stable for you when undertaking the injection. So typically, when undertaking the injection, you can do it either in a long or short axis orientation. It's a good idea to use an in-plane approach, and you might want to consider using a 21 or a 23 gauge needle. In the long axis orientation, it's useful to come from a cranial to caudal orientation. You're aiming the needle at approximately 30 to 40 degrees, depending on body habitus, and you want to bring it in between the tensor fasciolata and the gluteus medius tendon, i.e. the location of the trochanteric bursa. In the short axis orientation, you want to try and bring the needle in as horizontal as possible, so that it glides in between the tensor fasciolata and the gluteus medius tendon. If you bring it in this horizontal orientation, you should almost be able to see the full length of the needle as it passes into the trochanteric bursa. In both situations, it's useful to draw back on the plunger before injecting, just to make sure you haven't gone into any blood vessels. When you're undertaking the injection, you should see this area fill up quite nicely, and there should be a rapid improvement in pain symptoms for the patient from the local anesthetic that you use in addition to the steroid. In situations where the problem is chronic, you may consider to do a high volume injection to open up the planes and allow the area to move a little bit more. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below, subscribe to the channel, and share the video with your friends and colleagues. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all soon.